Welcome to This Explainer. Today, we're tackling a deeply personal, incredibly common, but honestly, rarely discussed topic that sits at the very back of so many expecting parents' minds. You know, pregnancy brings this absolute whirlwind of physical and emotional changes, and with those changes, often comes a quiet, hidden anxiety about intimacy. Specifically, we're talking about the physical mechanics of intimacy in pregnancy. It's totally natural to worry about how your body's intense physical responses might impact the little life growing inside of you. But today, we're going to dive into the research together and hopefully replace that hidden anxiety with empowering scientific facts.
So let's just tackle this exact question right out of the gate. Will experiencing an orgasm during pregnancy negatively affect the fetus? It's the absolute elephant in the room, right? Many couples are simply too cautious or maybe kind of embarrassed to bring this up during a standard checkup with their doctor. So what happens? They turn to the internet, they worry in silence, and they let fear dictate their experience. Let's bring this out into the light and look purely at what the medical and biological facts actually tell us.
Well, go ahead and take a deep breath. The bottom line? In most cases, it is completely safe. If you're experiencing a healthy pregnancy without any underlying medical complications, experiencing an orgasm is a perfectly natural, safe biological function. It's not going to harm your baby. Let's take a second to really let that narrative relief wash over us, because understanding the science behind exactly why it's safe is incredibly empowering.
All right, Section 1, Core Truth and Safety.
To understand why it's so safe, think of your baby as being secured inside a highly advanced biological fortress. The fetus is heavily protected by three massive physical shields. First, you've got the thick, muscular walls of the uterus enclosing the baby. Second, the amniotic fluid, which acts like a highly effective, pressurized shock absorber. And third, the cervix stays tightly closed, sealing the entire environment. Because of this phenomenal armor, the physical, muscular contractions of an orgasm absolutely will not injure the baby. They're completely insulated from any physical stress you might be imagining.
Moving on to Section 2, Baby's True Feelings.
And there's a really brilliant contrast here between what we fear and what's actually happening in there. During an orgasm, the mother's body experiences a brief, mild uterine contraction. Now, it's super common for mothers to panic at this point, fearing that this contraction is somehow, squishing or squeezing the baby. But looking at the fetal reality, because of that amniotic fluid, the baby doesn't feel a squeeze at all. To them, it just feels like a gentle rocking motion. Honestly, to your baby, it's basically the exact same sensation as you briskly walking down the street or rolling over in bed.
Now here's a truly surprising fact that totally debunks the pervasive myth of fetal hypoxia. That's the fear that the baby is somehow being deprived of oxygen. It's a really logical fear to have, but the science shows the exact opposite occurs. During an orgasm, pelvic blood flow significantly increases, and because of this, the actual blood supply to the uterus increases right along with it. You're quite literally delivering more oxygen and a better blood supply to the baby in that moment, not less.
There's another fascinating piece of data from the research. Studies actually showed that the baby's heart rate might briefly quicken during or right after you experience an orgasm. If you happen to be hooked up to a fetal monitor, this might look pretty alarming for a split second. But science tells us this is entirely normal. It's a temporary response that quickly resolves itself. It doesn't mean the baby is in distress, it doesn't mean they're uncomfortable, and it absolutely does not indicate a lack of oxygen.
Okay, Section 3, Mom's Normal Reactions.
So what about the mother's physical experience? There are two perfectly normal, temporary physiological reactions you might notice right after. First, a brief abdominal tightening. These are essentially false contractions. Since an orgasm causes the uterus to briefly contract, your stomach might feel tight or hard for a few moments afterward. Second, you might notice a slight increase in vaginal discharge. Both of these are completely harmless, standard bodily feedback. They're typically very brief, mild, and they'll quickly resolve on their own without triggering premature birth.
Next up, Section 4, Special Cases to Avoid.
Now, we do need to establish some necessary medical guardrails, because there are specific, high-risk scenarios where sexual stimulation, including orgasm, must be cautiously avoided. If a mother has a history of premature birth or is currently experiencing threatened premature labor, caution is absolutely required. The same goes for conditions like placenta previa, any unexplained vaginal bleeding, or cervical incompetence, which is just when the cervix begins to open too early. And of course, if your doctor has explicitly advised you to avoid sexual activity, you must follow that guidance. In any of these situations, you really need to consult your obstetrician before engaging in any sexual stimulation.
Which brings us to Section 5, Red Flags for Doctors.
Let's create a visual mental checklist here to clearly separate what's normal from what's abnormal. On the one hand, we've got the harmless effects we just discussed, the brief tightening and the slight discharge that quickly go away. But on the other hand are your medical red flags. If you experience persistent, ongoing abdominal pain, or if those contractions become regular and rhythmic, that's a serious red flag. If you experience any vaginal bleeding, a sudden leaking of fluid, or if you notice a distinct, abnormal change in fetal movement, you need to contact your healthcare provider or go to the hospital immediately. Separating the brief, harmless feedback from these serious medical indicators is key to staying safe and confident.
So knowing all of this, knowing your body's true feedback, are you ready to let go of that anxiety and enjoy a more relaxed pregnancy? We've looked at the remarkable armor of the womb, the reality of increased blood flow, the gentle rocking the baby actually feels, and exactly when you need to loop in your doctor. The science heavily points to safety, resilience, and perfectly normal bodily mechanics. But it really makes you wonder, if the biological reality of pregnancy is this resilient, what other common pregnancy fears are rooted in myth rather than medicine? Keep asking questions, trust the science, and reclaim your peace of mind.